Hello, everybody. Dr. Shadi Ireifej here, board-certified surgeon, chief of specialty, and part owner of TrueCare for Pets in Studio City, Los Angeles, California. 24/7 emergency and specialty hospital, here to help you and your pets out. We are going to talk today about a very common medical condition, heart murmurs, cardiac murmurs. You hear it a lot. Maybe some of you listeners out there have a murmur, or you had one when you were younger. And animals do get murmurs as well. So we'll talk about some basics on heart anatomy, and then we'll talk about exactly what are murmurs, and then why should you try and diagnose what's causing the murmur. So the heart anatomy in dogs and cats is similar to people. The heart is made up of 4 chambers. Those chambers are what hold the blood. The valves are the gateways. And what the valves do, there's 4 valves, 1 for each chamber, and the valves are timed with the contractions of the heart to let a certain amount of blood in and out of the heart on a certain rhythm. And so everybody has a normal rhythm, and there's a certain amount of blood that's going to go to the chambers, leaving 2 chambers relatively empty, and then those 2 chambers will get filled with blood, empty out the blood, and it just kind of circles that way through the valves. So when you have a condition that either affects the valves themselves, the actual structure of the valves, you can get what's called a heart murmur. And the reason why is because the valves are designed normally to have a very tight seal to hold the blood in the heart. When the valves get diseased or malformed or traumatized, or they have an infection, whatever it is, and they no longer have a tight seal, well, every time they try to close, blood will pass through them. And the blood that passes through the valves, that leakage, right, leaky valves, that's the sound that a veterinarian can hear with a stethoscope. That's what creates this. That sound is called the murmur. And that's what a heart murmur is. So if you have a leaky valve because of whatever disease process, then the blood that leaks through the valve, or in between the valves, I should say, the veterinarian can hear as an abnormal sound, and that's a heart murmur. And that's one cause of heart murmurs is a structural abnormality with the valves. The second cause for heart murmurs are going to be something more physiologic. So, for example, a common example actually is anemia. You can imagine if you have anemia, which is a lower than normal red blood cell count, so you're anemic, right? If there's less red blood cells in the blood, then for simplicity purposes, the blood is going to be more watery. There'll be less stuff in the blood. And so that wateriness also will leak through the valves and create that same sound and get a heart murmur. And so anemia is one example of a physiologic reason why you could have heart murmurs. Now, unique to dogs and cats, probably more so cats even, you can also have, I guess, a third category for heart murmurs, which is just like stress related. Cats will do this a lot if they get really stressed out. It seems to be some kind of a stress response to the murmur or to the heart, and that creates a sound that the veterinarian will think, okay, that's a murmur. But of course, obviously, it's hard to prove that your cat's stressed out, right? So things like leaky valves or anemia, etc., those are things you can actually diagnose based on testing. But a behavioral or stress response causing a leaky valve, that's a little different story. It's hard to prove. So in theory, you would assume that if your animal, if your pet, your dog or cat has a murmur due to either structural reason like disease or a physiologic reason like anemia, the murmur won't go away unless you fix the problem, right? But if you have a stressed out animal, the murmur in theory would come and go depending on their stress levels. So that's just one way to look at it. And I guess there probably in theory is a fourth reason for heart murmurs, I suppose. So some animals that are really tiny, so cats and small dogs. I mean, if you are trying to feel the heart through the chest and you push a little too hard, it won't hurt your pet, but you can create a murmur that way. You can create an artificial murmur because you're by squeezing on the chest, you're deforming the heart structure, and so you're going to create leaky valves, and you can actually get a sort of artificial murmur that way. But that's not something that's commonly seen, especially in experienced veterinarians. Usually young veterinarians are the reason why that sort of murmur exists. They're just not used to how firmly they can push on the chest of a small animal. So that's just another thought. But really what we're going to focus on is going to be the structural and physiologic reasons. Now, keep in mind, of course, I am a surgeon, so my knowledge of murmurs come through really with just anesthetic safety. I'm just worried about, will this patient with this heart murmur be okay with anesthesia? And so that'll bring us to our next topic here, which is why should you care about heart murmurs and what should you do about it? So why should you care? Well, it's just like in people. If you have a heart murmur and you're going to have anesthesia or something, sedation, then obviously drugs affect your heart, right? That's part of the way analgesics work, anesthesia works, and why sedatives work. And so you want to make sure your heart's healthy enough to handle the anesthesia. Also, a lot of times when your pet goes to the hospital, they are going to be dehydrated. So they're going to be on IV fluids, right? Intravenous fluids. They're going to have an IV catheter. So they'll have a catheter in their veins, and the doctor's going to give fluids through the veins to rehydrate them. Same thing you do with people. If you have a heart that's abnormal, like a leaky valve, well, in theory, if you give too much fluids, or rather I should say, if you give the amount of fluids that a normal animal should handle to an animal that has a leaky valve, heart murmur, right? Then in theory, you could fluid overload them. You can give them too much fluid, not out of ignorance or maliciousness, but because you gave a normal amount of fluids, or what should be a normal amount of fluids, to an animal who really couldn't handle it. And so you want to make sure the heart can handle the IV fluids that you're giving the pet. And that's a very common scenario. I mean, anybody who's had a cat in the hospital with a murmur, and the cat goes into the hospital for any reason that requires intravenous fluid therapy, they can go into heart failure, where the fluid will back up from the heart into the lungs because the veterinarian gave what is supposed to be a tolerable amount of fluid. It's a tolerable amount, it's a normal amount of fluid, but to a patient whose heart couldn't handle it. So you care about heart murmurs because it can cause other problems concurrently with whatever it is you're trying to do, whether it's anesthesia or give IV fluids. And of course, you want to know because that's part of the health of your pet, right? For some reason, as veterinarians, we tend to ignore heart murmurs, or we tend to say, oh, you've got a heart murmur, we'll just watch it. That's something I've never understood, because that's equivalent to saying you've got a broken leg, let's just watch it, let's see what happens. It's a part of the body that's abnormal right now, and it's the heart. It's like the most important part of the body, and it's abnormal, and yet for some reason as veterinarians we don't pursue it. And I have my theories why. We'll kind of visit that at the end of this. So you want to know about heart murmurs because part of the knowledge base that you want for your pet's health, and also because it puts them at increased risk if they have a heart murmur and they're undergoing anesthesia and surgery, or they're receiving intravenous fluids or what have you. So what do? You go to your vet, they find a heart murmur. It's never been diagnosed before, right? For the first time you've diagnosed a heart murmur in your dog and cat. Now what do? Well, you want to figure it out what the reason is. So we already talked about two examples like anemia and leaky valves, right? Well, that's pretty easy. Anemia, you do blood work. You look for any reason why your dog or cat may have a murmur because of illness, whether it's thyroid disease, kidney disease, anemia, whatever it is. You do the blood work and you figure it out. But the blood work, keep in mind, does not actually show you the heart, right? You can't see what the heart valves look like on blood work. So you need a test that'll tell you what the valves are doing. Well, the best test we have is ultrasound. So ultrasound, which is, for those who know, are like sonograms. So if you're pregnant, right, the doctor will do a sonogram on your belly to look at the baby. So you do a sonogram of the heart. It's called an echocardiogram or echocardiography. And the difficulty with echocardiography is that usually it's pricey, probably somewhere around the $600 give or take range, depending on the area of the country you're in and what they want to charge. But also there's not a lot of veterinarians that perform echocardiograms, and they're called echoes for short. So as a surgeon, of course, I'm not trained in echoes. Most of the time it's either a very, very experienced general practitioner, or you need an internal medicine specialist, or ideally a cardiologist, and they're the ones that'll do the echoes. So with no sedation, they shave a small part of your pet's chest, and they place the probe over the heart. There's no incision being made. There's no anesthesia, and they can look at the heart through sonogram. And that's how you diagnose a murmur. And they'll do their measurements, and they'll look at the structure of the heart, and they'll see if there's any leaky valves, if there's any backflow of blood. And you would assume that backflow of blood is what's causing the sound the veterinarian is hearing, which is the heart murmur. Based on the echo, you can then say, okay, well, we know that the murmur is being caused by this, and now what can we do to treat it or prevent it from progressing? And that question can only be answered once you do these tests, because you don't know otherwise. You don't want to put your pet on heart medication when it's an anemia problem, right? That doesn't make sense. It wouldn't work. And so you want to make sure that you characterize the murmur, what's causing it, how severe is the disease, and then what can you do to prevent it? And do you need heart medication? Do you need thyroid medication? What do you need? And so that's why you care about murmurs, because it's an abnormality. And that's how you figure out what's causing the murmur, how to treat it, what's the prognosis. Because don't forget, just like in people, heart disease is at least top 3 reasons why pets die. Absolutely. It's up there with kidney disease and cancer. All right, those are top 3 reasons why dogs and cats die as they get older: kidney disease, cancer, and heart disease, just like in people. The difference is, of course, the animals' heart disease, and this is getting off topic a little bit, heart disease in animals is usually not due to obesity or atherosclerosis. We don't get heart attacks in animals. We don't really see strokes in animals, infarctions, myocardial infarctions. We don't see that in animals commonly. There have been reports, but not commonly. So now you have a patient with a heart murmur, and you try and diagnose it, and you try to treat it. You want to treat it so that you prevent progression of disease, avoiding heart failure in the future, which would shorten longevity of your pet. Now, here's why I think we tend to ignore murmurs. And this is kind of, this will be just sort of an additional discussion here. Number one, it's really difficult to find a veterinarian or veterinary specialist to perform an echocardiogram. There are not very many cardiologists in the United States, let alone your area, your city. And to find a general practitioner who's been trained in echoes or an internal medicine specialist who's been trained in echoes can be very difficult. So it's really a pain in the butt to try and coordinate an echo with a veterinarian who knows what they're doing. That's number one. So number two, and along those same lines, you diagnose a murmur and you figure out, well, it's not physiologic, it's not stress related, it's not any other disease, it must be the actual heart. We need an echocardiogram. Usually you have to send the client somewhere else to get that echo done. Now, there are traveling veterinarians that'll perform echoes. You call them up, they'll tell you what day, what time they can get there, and they show up and they do the consult. But that's also not a very common thing anyway. And so you not only have to find the specialist, do the examination, but chances are that specialist is not even going to be in your building. You've got to send the client and their pet out somewhere else to get it done. Third, I think it's also kind of an out of sight, out of mind, because it's a heart murmur. You know, I compared it earlier to a broken leg, but it's kind of not, right? Because you have a broken leg, you'll see your pet limping all the time. It's obvious. You're being reminded all the time that your animal has a broken leg. However, if your pet has a heart murmur, you're not going to notice anything different with them. They're just going to be living their life with a heart murmur, and you can't tell, and neither can the veterinarian. Obviously, you only can tell it based on the stethoscope exam, the heart exam. So it's out of sight, out of mind type of ordeal as well. I don't think in general we deal with heart murmurs with the seriousness that it deserves as veterinary professionals. And I think that you as a pet owner, if you have a pet that's diagnosed with a heart murmur, it behooves you to ask about how you can work up the murmur further. So here's something else that's along the same lines. Heart murmurs can be graded from 1 to 6. 6 being most severe. Like a heart murmur at 6 out of 6, you can hear without a stethoscope. You can hear it outside the pet's body. A 1 out of 6 is a very slight murmur, and of course in between. So we also tend to correlate the severity of the murmur based on numbers, which is of course subjective, to how bad the disease process actually is. There's been studies that show that the number of the murmur, the severity to which your veterinarian classifies your murmur based on a 6-point system, does not correlate to how severe the heart disease actually is. So when I listen to a heart murmur and I think, okay, that's a 2 out of 6, number one, that's just my subjective numbering. Another colleague of mine could listen to the same murmur and think it's a 1 out of 6 or a 4 out of 6. So there's subjectivity there. And secondly, the number for the most part doesn't even matter because it doesn't really correlate all the time in every case to how bad the heart disease is. So we have to give it a number to make it as objective as we can so we can document it and see if over time the number changes. Sure, you have to. But at the end of the day, if you have a heart murmur, you have a heart murmur. You need to figure out why that murmur is there. So as a pet owner, it behooves you to ask the veterinarian what's causing the murmur. How can we get it worked up? And of course, this implies that you actually want to know what's causing the heart murmur, and that financially you can afford getting the heart murmur reviewed, evaluated, and it's reasonable or realistic enough for you to find a veterinarian who can perform the echocardiogram to diagnose what's causing the heart murmur. So for veterinarians out there, especially coming from myself as a surgeon, I prefer that heart murmurs are worked up ahead of time. I want to make sure that my patient is as safe as possible for anesthesia. If the cardiologist does the echocardiogram, diagnoses the cause of the heart murmur, puts them on heart medication, I want to make sure that we have ample time to let the heart medication work so that my patient is as safe as possible for anesthesia, understanding the risks are always there, but at least trying to minimize those risks as much as possible. Pet owners, be the voice of your pet. You have a heart murmur, go figure it out. Go find out what the cause is. I'll tell you right now, financially speaking, it's much cheaper to diagnose and treat a heart murmur now than it is to diagnose and treat heart failure later on. The heart murmur itself is not a life-threatening condition in the immediate time period, but congestive heart failure absolutely is. That can kill your pet. So you want to make sure you're proactive as a pet owner, be the voice of your pet. Make sure you follow through. If you're diagnosed with a heart murmur, doesn't matter what number it is, 1 through 6, get it figured out and do right by your pet. So I hope this podcast helps you not only learn a little bit more about what causes a heart murmur, what it actually is, how to diagnose it, why would you want to know about it, why would you want to treat it, and of course you get my 2 cents as far as how I think we handle heart murmurs in the veterinary field. This is Dr. Shadi Ireifej, TrueCare for Pets, staff surgeon, chief of specialty, and part owner of the 24/7 beautiful veterinary hospital in Studio City, Los Angeles, California. Please feel free to email me any questions at TrueCare for Pets Pawcast, that's P-A-W, Pawcast, @gmail.com. Thank you so much for listening. Talk to you soon.